Is there a second?
Second.
All right, we have a motion second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass. I'd like to go to item L1. We have Shane Turner and Fiona Bond here. This is regarding the U.S. Department of Treasury Coronavirus Local Fiscal Recovery Fund American Rescue Plan Act discussion or action regarding the eligible expenses and our funding guidelines, reporting requirements, and funding request. Okay.
So I'm Fiona Bond, Executive Director of Creative Waco, and of course this is Shane Turner, owner and operator of the Hippodrome.
All right, so we will recess until 1 o'clock tomorrow. So it's 11. All right, good morning. Let's call court to order. Today is Tuesday, March 1st, 2022. It's 9 a.m. Proof of posting, please.
The agenda was posted on Friday, February 25th, 2022 at 3:10 p.m.
Thank you. And if anyone has a public comment, they can come forward now from the audience. Yes, sir.
My name is Shannon Caraway. I'm Vice President for Business Development for a company called Solar Prime. Currently, we're trying to develop another 300 megawatt solar farm and 300 megawatt battery energy storage project here in McLennan County. And it's out north of Trading House Creek Reservoir, that area there. We're preparing to submit a proposal to this body soon for a county tax abatement for the project, and just wanted to stop by ahead of time, introduce ourselves, and tell you what we're doing.
Going to D on the proclamations resolutions, we have nothing this week. Under E, under consent agenda, I have no recommended pulls. Does anyone else have a pull from the consent agenda they want to discuss? Seeing none, is there a motion to approve the consent agenda?
So moved. Second.
Motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass. All right, Dustin.
Yes, sir. Judge, if we could go to item N1, this is discussion and or action on matters regarding COVID-19.
These case numbers have decreased for the hospitals.
All right, Judge, do you want to accept that for recording purposes?
Yes. Is there a motion to accept that report for recording purposes?
So moved.
Second.
There's a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
All right, if we could go to item N10, presentation from Texas State Technical College regarding Central Texas Industrial Training Center.
There's a mismatch between the number of jobs that are available and the number of people that are available to fill those positions.
Move to accept for recording purposes. Second.
Have a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
All right, if we could go to item N6, that's the Greater Waco Chamber of Commerce Monthly Economic Development Report for January 2022.
Know that we have had one project announcement for this first quarter, and that was in McGregor with Messer.
All right, if there's no questions, is there a motion to approve the chamber report for recording purposes?
Motion to approve. Second.
We have a motion second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass.
All right, we can go back up to item F, budget amendments. F1's regarding the FY22 budget. Francis?
FY22 budget amendments, starting with F1A.
Is there a motion to approve F1D through F1I?
So moved. Second.
We have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
Under item G, bids, RFPs, RFQs, G1 is authorization of recommendations. G1A regarding bid 22-004, aggregate surface treatment for delivery and pickup.
All right, what's the pleasure on items G1A?
Motion to approve the purchasing director's recommendations on the bids.
Second.
We have a motion second. Any other discussion? No discussion. All in favor say aye.
Aye.
Opposed? Pass. All right.
All right, item G1B regarding bid 22-005 asphalt emulsions for delivery and pickup.
Not what's the pleasure of the court?
Move to approve the recommendation of the purchasing director.
All right, is there a second?
Second.
All right, we have a motion, second, any other discussion? No other discussion, all in favor say aye. Aye. Opposed? Okay, good morning, everyone. Let's call court to order. Today is Tuesday, May 3rd, 2022. It's 9 a.m. Proof of posting, please.
The agenda was posted on Thursday, April 28th, 2022 at 3:15 p.m. and the supplemental agenda was posted on Friday, April 29th, 2022 at 4:15 p.m.
Thank you. Let's stand briefly for a moment of silence, and then we'll have our Veteran Service Officer, Steve Hernandez, lead us in the pledges of the flag.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now the Texas pledge. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Okay, thank you. Thanks, Steve.
Yes, sir. Yes, sir.
All right, if there's any members of the audience who want to speak to the court on issues, please come forward this time. Seeing none, going to under D, under proclamations. I have a proclamation I'd like to read regarding the proclamation of the Commissioners Court in McLennan County recognizing Travel and Tourism Week. And so, Dan, and if you'd like to come forward, and any of your folks that you want to bring forward and introduce, I'll read, if I can read the proclamation sitting down, I'll do it better.
You can do whatever you want, sir.
Okay. All right, so I know Carla's here, and
Yeah, we have, well, first, thank you for the opportunity to spend a couple of minutes with you. Our staff here from the Convention and Visitors Bureau, we have Assistant Director of Tourism, Carla Pendergraft, who's been here since the first tourists got here back in the and Susan Morton, who runs the Waco Welcome Center, and Kate Lilly's over there taking pictures, who's also over at the Welcome Center.
okay.
I'm Dan Quant, I'm the Interim Director of Conventions and Tourism.
All right, well, welcome. All right, this is a proclamation of the Commissioners Court of McLennan County, Texas, recognizing May 1st through the 7th, 2022 as Travel and Tourism Week. Whereas travel and tourism has been a consistent driver of McLennan County's economy and workforce, and whereas a robust travel and tourism industry provides significant economic benefits for McLennan County and the nation, generating more than $18.9 million in local tax receipts in 2019, and with $11,100,000 spent directly by visitors to McLennan County. And whereas travel and tourism has been the foundation of a healthy workforce in McLennan County, supporting 6,000 jobs in 2019, and whereas spending by travelers has aided state and local governments alike, generating $180 billion in tax revenue in 2019 to support essential services and programs. And whereas the coronavirus pandemic devastated every sector of the travel and tourism industry with staggering declines in 2020 compared to 2019, affecting every community in the county, in the country, including McLennan County. And whereas the travel and tourism industry cannot recover without the full return of leisure and business travel, as well as meetings and events by both domestic and international visitors. And whereas the rebound of travel and tourism will drive the rebuilding and revitalization of our economy and workforce towards a more prosperous future, and now therefore be it proclaimed that the Commissioners Court of McLennan County do hereby proclaim May 1st through the 7th, 2022 as Travel and Tourism Week in McLennan County and encourage all residents and businesses to welcome the visitors to our fine county, and be it further proclaimed that a copy of this proclamation be made a permanent part of the minutes of the Commissioners Court. Witness our hand and seal this second day of May 2022. Signed, Scott M. Felton, McLennan County Judge, James Smith, Commissioner Precinct 1, Patricia Miller, Commissioner Precinct 2, Will Jones, Commissioner Precinct 3, and Ben Perry, Commissioner Precinct 4, attested by J. Andy Harwell, County Clerk of McLennan County, and by the Deputy County Clerk, Mercedes McGowan. All right, let me do this officially. Photo op. Where do you want us? Let's here, face this way. You get the cord.
Put the bag down.
All right. Perfect. Y'all are very photogenic.
Yeah. All right, you want to say a few words?
Certainly, thank you, Judge. Tourism, with those 6,000 jobs that were mentioned, that is actually one of the biggest industries in the county and in the state of Texas. As was mentioned, coronavirus impacted the tourism industry probably harder than any industry. People just, for some reason, didn't want to travel. I don't understand that. We got fine medical facilities here, but still, this is a tremendous attraction. The whole county's a tremendous attraction for Texas. We're actually one of the top sites for tourism in the entire state of Texas. It's one of the top occupancies in terms of our hotels, all that. So this isn't just a little fly-by-night thing. It's a very serious industry. Brings a lot of people in, and a lot of people. Everyone that comes to this county looking to relocate to either for personally or to bring a business into town is first looking at us through the eyes of a tourist. And so we always want to put our best foot forward. And the last thing I'll say is I encourage you, whether it's your fellow commissioners around the state of Texas or your departments, we'd love to have all of them come to us and say, we want to host our fellow Texans for our state convention here in Waco. So encourage them, and help continue to bring those dollars here. Now we do have, where did I put that bag? Oh, right here. Now you guys are gonna have to share.
Okay.
But there are
Thank you.
like 3 cookies in there. So so split them apart. They're good sized cookies and an ornament from the CVB over here, so you can put that on your county tree in a few months.
Okay.
All right.
Thank you very much.
Thank you very much.
Oh, okay, good. Okay.
Thank you so much.
Thank you. All right, thank y'all so much.
Thank you.
Thank you. Appreciate it.
All right, we also, under D2, I make a motion, we approve that proclamation.
Second.
Have a motion, second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass. All right, next is under D2, ratification of resolution in loving memory of Mr. Theodore Todd Slaughter. Commissioner Miller?
Good morning. I'm always saddened but honored when families ask for remarks from the county at the services of their loved ones. And we've seen that for the last couple of years, it's been kind of an aggressive homegoing season for us here in McLennan County. But the gentleman last week, or the week before, that I attended his services was a dear friend, and I'm sure many of you have heard of him. If not, you've seen his work around town, Todd's Flowers. I just want to read one paragraph into the minutes. I did present it to the family at the funeral, and like all the other funerals, they were very appreciative. But on Sunday, April the 10th, 2022, McLennan County bid farewell to a man who distinguished himself as an entrepreneur and the first African-American florist in McLennan County, Texas. In 1952, Mr. Theodore Todd Slaughter began what would become his life's work and calling, working in a flower shop. 18 years later, in November of 1970, he opened the doors of Todd's Flowers in historic East Waco on the equally historic Elm Street where it stands today. For 52 years, Mr. Slaughter provided floral arrangements and made deliveries throughout McLennan County for countless special events. And he just was a man of character, well-known in the community. It was sad to see him go, but we will always be appreciative of his impact in our county. And again, like I said, I get these on a short turnaround, so that's why they're normally ratifications. But if there are no questions, I would just move to approve the ratification of the resolution in loving memory of Mr. Theodore Todd Slaughter.
Second.
All right, have a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass. Thank you. All right, Dustin, there's two action items in the consent agenda.
Yes, sir. They are E3A1 and E3A2, if we could pull those.
All right. We're gonna pull, as mentioned, E3A and E3A2. Are there any other pulls recommended by the court? If not, is there a motion to approve the consent agenda with the exception of the two pulls mentioned?
So moved.
Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass. Thank you.
And
Under
Judge-
E3A is a notice to retire from Lisa Fitch. She's been with the county for many years, and I think close to 30, if not a little bit more than that. Been a real fixture around the community, and she's done a great job. We just got through doing department head reviews where she gave a lot of insight on what's going on with her department, and it just reminds us how much we appreciate good department heads and folks and other employees that work here at the community. And I'd like to move that we accept her resignation with regrets. Is there a second? We have a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass. Thank you, Lisa. All right, under E3A2, discussion or action on replacement, and I'd like to hold that to the end of the meeting. All right, Dustin, if you want to pick it up from there.
Yes, sir. Judge, if we could go to item F, budget and budget amendments. F1's regarding the FY22 budget. Francis?
Thank you. So yes, for FY22 budget amendment, starting with F1A, this is a budget amendment in the general fund for County Court at Law 2, and they're requesting to move within their department into furniture and equipment to purchase an assisted listening device for their courtroom. F1B, this is in the permanent improvement fund. The request is to move from the contingencies line in that fund into the line item for the building modifications at the sheriff's office. So they need to increase that project by $3,200. F1C, this is general fund for the tax office, automobile side. They're requesting to move within their department into other services and charges for some document imaging cost. And then F1D, this is general fund for JP Precinct 2, also requesting to move within his department into furniture and equipment in order to buy some furniture and other equipment.
All right, thank you. Any questions on F1A through F1D? If not, I'll entertain a motion.
So move.
Second.
Motion been made and second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
F1E is authorization of Texas Association of Counties claim deductible invoices. F1E1 is an invoice totaling $1,870 for a claim associated with Merica Campbell, and this is related to juvenile detention. And F1E2 is an invoice totaling $705 for claims associated with the estate of Charles Ray Mason, and this is a law enforcement claim.
Okay, any questions? If not, is there a motion to approve F1E and F1E2?
So move. Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
F2 is regarding the FY23 budget. F2A is recording of calendar for FY23 budget and corresponding tax rate. Francis?
Yes, so in your packet, you'll have the proposed calendar for the 2023 budget and the related tax rate. So it's, of course, similar to our timeline we usually see each year, but I just wanted to go over a few highlights. So we're in the process, of course, of collecting information. So packets have gone out, and we expect by the end of the week to have the bulk of those requests into our office so we can start compiling them. On Tuesday, May 31st, that's the 5th Tuesday agenda of the month, we plan on having a workshop where we will look at preliminary assessed values, and then the preliminary rates that go along with that. So see what that looks like. We'll also review our goals, just get some feelings about how we want to proceed into the summer. And then we'll also review the budget process and then the tax rate process. And so I know that's always good for us internally as a group here, but that will also be good for the public to hear the details of the process that we'll be going throughout the summer. Then by Tuesday, June 21st, we will have all the information for you on the budget drive compiled in the worksheets. This year, we're also going to be presenting you with kind of like a binder per se that's going to have a lot of trend, historical information, things that usually come up during discussion. So, what was the tax rate for the last so many years? What was the COLA given? We'll be presenting a lot of budget to actual numbers to gauge where we are in the current year as well as where we ended in past years. So we'll be getting that to you as well this year. And then that leads us into July. So starting July 5th, that Tuesday after the holiday, we'll begin the heavier workshops where we will go through all the funds and the request. We will not meet the week of July 11th. That one you can mark off. And then that month, we will be presenting you, like we did last year, a very detailed schedule of those days in July. So who will be coming again, what we're going to cover, so that you can plan accordingly. And then just moving down July 28th, we will vote on a proposed tax rate and file the proposed budget. We have some dates, publications, things to work through that next month. And then ultimately leading up to Tuesday, August 30th, we'll have a public hearing on the budget and then adopt the budget and the tax rate. If needed, if your proposed tax rate exceeds the lower of your no new revenue or your voter approval rate, we'll have to have the public hearing on the tax rate within a certain number of days. But if your proposed rate does not exceed that no new revenue rate, which that was the situation we were in last year, then of course, the public has the opportunity to speak at any meeting in the public comment section.
You said the no new revenue rate. Was there another rate? And then we
There's
have
the
to have a
voter
public-
approval rate.
Oh, like the,
So,
used to be the rollback? Okay.
Ours, the voter approval will always be higher in our county, but there are counties where those get flip-flopped for different reasons.
And then we need to have a public hearing.
Yes, if your proposed rate exceeds the lower of those two rates.
Okay.
Last year, you proposed right under the known, or maybe at the no new revenue rate, I believe. And then we brought it down even further through discussions. Any questions?
Yeah, a couple. One, did you say July 11th would not, or what's the?
The week of July 11th, there's a conference that.
North and East.
North and East.
So we'll meet that first week, July 5th. We'll give you a lot of information that week, and then have that week of July 11th for y'all to think on, what we've gone through that first week, and that'll that'll help, I think, help the
Right.
process along.
And then,
Oh, go ahead.
and then on the public hearings, we will have one or more.
So the statute, it changed a couple years ago, but right now you only have one on the tax rate if you propose above the lower of the no new revenue or voter approval rate. If not, your publication is different and there's different wording. But budget, we must have a hearing on the budget, and it must be right before we adopt, so it'll be on that same day.
Okay, well, the time of day for that hearing may be important, and so, if we're gonna have one, then I propose, or at least, the court consider having that one at 5:30 or 6 in the evening. That
Yes.
people could be here.
Yes, and we're flexible, whatever dates, if there's ever any meetings y'all want to have a later time during the day, just keep us posted and we will be
Okay.
available.
Any questions? Any other questions, comments about that? All right, is there a motion to accept that report for recording purposes?
So moved.
Second.
We have a motion, second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass. Justin?
All right, Judge, I know Randy McGraw's in the audience, so if we could go to item M8 regarding the McLennan County Group Health Plan update from Hub International. Randy?
Randy, good morning, come on up.
Morning.
Did you drive here from El Paso? Okay,
Good morning, I'm Randy McGraw with Hub International. Morning, judges and members of the court. It's a pleasure to be here in person in Waco. And the purpose of the visit is to review with you our financial forecast for the self-funded health plan and the dental plan. And there it is on the screen as well. And I'm happy to take any questions along the way. We've had some meetings with your insurance committee, a couple of meetings already this week, or this year. And basically, the health plan is performing well. And so from a budget perspective, I don't see any need to increase any contributions from the county, nor any contributions from employees. And unless there are some benefit changes that we want to make to the plan, there's no need to do that in order to help control costs. You'll see in a couple of categories in the report, some areas where we'll be doing some additional discussion amongst the committee and as well with United Healthcare, and I'll point those out when we get there. If we could go to the third page of the presentation, and I'll review the highlights with you. So currently, if we're measuring the unit cost of consumption of medical services under the plan, which means we're basically how much on average does each person covered under the plan consume, our rate of consumption of medical expense is negative 18%, which is fantastic. That's good news there. However, in the second bullet point, you'll notice that our increase in the consumption of prescription drugs is up pretty dramatically, at 88% higher than it was a year ago. And I've got a couple of notes and comments to share with you on what's driving that. Overall, the pace of inflation on the health plan is just under 5%. Normal for the area in Texas and even in the central Texas area, as well as the state of Texas, 7% is about the average pace of inflation. So we're looking really good on the medical side, a little bit high on the pharmacy, but overall outperforming expectations in the marketplace. On our next slide gives you a graphical representation of our ride as on the measuring the unit cost of inflation year over year. And you can see that big jump on the prescription drug consumption. And actually that increase began, I believe it's coincidental with the change in the health plan administration from Scott and White to United Healthcare right after January the 1st. And that prompted us to collect some additional information as well. And it's a fairly lengthy report, but I think it's interesting to me that in the categories where I see the increases happening on the prescription drug utilization, it's actually not such a bad thing. It's an indication that people are taking more medications, higher cost medications for drugs or for conditions that are controllable. And to give you an idea, just in the category of diabetes, so any medications, whether it's insulin or oral medication for diabetics, the pace of consumption there has increased 360% in the year of 2021. And so that's a good thing, because if you're not controlling your diabetes, it could lead to more chronic conditions and high-cost conditions and renal failure and things like that. So that's not necessarily a bad thing. Our other category that shows a pretty high level of increase is in multiple sclerosis, and that's up 43% just in the last year. And musculoskeletal disease, like inflammation of joints and pains and things like that, are up 44%, and cholesterol-related drugs are up 36%. So those are some of the top conditions, chronic conditions that most health plans recognize. It's not unique to McLennan County, but the good thing is it looks like people are compliant with their medications, because if they weren't, we'd be seeing that medical consumption rise in conjunction with the prescription drug side. So sometimes prescription drugs, well, not sometimes, but prescription drug claims fly through the reporting system quickly. When you make a transaction at the pharmacy, everything's electronic. It gets reported back to United Healthcare, gets deducted out of your bank account, and then it shows up in a report quickly. On the other hand, medical claims take a little bit longer to process. From the time you go into the hospital or have some type of procedure, it might be 30 or 60 days before you see that information flow through. So pharmacy consumption is kind of a leading indicator of what's going on inside of the health plan. But the good news is that we're not seeing any high-cost claimants or catastrophic claimants through this time period. And this report was actually generated so it could get to you on your agenda with claims data through the month of February. The month of March information came out just last week. So I have looked at it, and it's consistent with the same pattern that we're on right now. So there's no new scary information that manifests itself in the last 30 days on the loss data in the health plan. On our next page, this is just a summary of some of the claims data and some additional charts. And so far, we've only got, or last year, we only had one person exceed our reinsurance deductible, which is good. And we have a page coming up that'll show you year over year how many people in terms of high-cost claimants have exceeded that threshold. And so far, year to date in 2022, we've got nobody that's had a high dollar claim like that. On our next page, this is just a monthly view of the total claims expense for medical and prescription drugs. So you can look back over time and see, you know, that every now and then there's a couple of spikes. Those are usually driven by some high-cost claimants that we've had. 2021 was a fantastic year. There were a lot of other plans that we work with, and just, you know, in general in the public, where after the pandemic in 2020, where some care might have been delayed or postponed, a lot of self-funded plans saw a surge in claims expenses in 2021 as people went out to catch up on delayed medical care. But you can see in our graph there that that doesn't appear to have happened here. So that's good too. It's just a strong indicator of the underlying overall good health of the employees and dependents and retirees that you have covered under the plan. And on page 8, which is on the screen right now, that's our dashboard report, so to speak. And it has a lot of good metrics on this page too. On the right-hand side is the average PMPM, which stands for per member per month cost. That's a unit cost. So it's basically just taking all of the expenses of the plan divided by all the people, whether they're employees or spouses or dependents, divided by the number of months, and it tells us what the average rate of consumption is on the different categories. So in the upper right corner of that grid, you can see the average for the years. And bear in mind, for 2022, this is just 2 months of data. So it's not being spread out over a large block of time. But you can see in 2020, we ran $372 per person, and that declined to $342 per person per month. We're currently at $394. The month of January was a little bit higher than normal, and there's just 2 months in this calculation here, so it's a little bit distorted on the high side there. The other thing that you can see too that's really good is in that next section on going down is the cost by relationship. So it measures the unit cost for employees, spouses, and children. And you can see in that column to the left of that side, the average number of people covered. So for example, there's 82 spouses covered under the plan right now, 496 children, 1,017 employees or retirees are embedded in that number. But one of the things that's really neat to see here at McLennan County, unlike most other health plans, is that spouses typically cost a lot more than employees. Last night I was reviewing a similar report with a school district in Laredo. We've got 3,000 employees, and their numbers were for an employee average cost on this grid, $500 per month for them, and for the spouses were $1,200. And so a lot of times you might see the spouse category up about 30 or 40% than the employee. But in your case, it's more like within 10%. And when you look back at the prior years, and so far this year, it's a low number, but it's just 2 months worth of data. And then you can see too on the bottom, or in the next section down, measuring the same unit cost by the plan. So the county offers 2 plans. One we call the base plan, which is more of a traditional type of open access PPO plan with deductibles and co-pays and co-insurance. And then there's the high deductible health plan that has a higher deductible, no co-pays for office visits, but a lower out-of-pocket limit. And typically, you'd see the consumer-driven health plan operate at a lower average expense than the base plan. But you can also see that overall, we've got 512 total members in the consumer-driven health plan and double that in the base plan. So again, the number is a little bit short relative to that. And so when the consumer-driven health plan is coming in at where it is, where it's not a very big difference between the base and the consumer-driven, it's an indication that some of the higher cost claimants overall are the ones that use the health plan more frequently or enrolled under the consumer-driven health plan, which is good for them because they're the ones that are most likely to have the most highest consumption during the course of the year. And that means they'll likely reach their out-of-pocket maximum as an individual, and the out-of-pocket maximum is lower in the consumer-driven health plan than the base plan. So from a financial perspective, and having the high-cost people in that plan is not bad. It's good for them, helps them save some money relative to them being enrolled under the base plan. And then in the bottom portion there, you can see too, same data split out by your active employees. The retirees under 65, you've got just a couple of retirees that are grandfathered under the retiree plan, the self-funded plan. When retirees age into Medicare, they leave your self-funded plan and join a fully insured Medicare Advantage option that the county offers through United Healthcare. But you have some retirees that aren't fully eligible for Medicare, so they're still covered under the self-funded plan. And you can see again there, I think on average, retirees under 65 usually cost about double the cost of an active employee, and your numbers are right there at just about double. And then in the over 65 category, of course, the older we get, more drugs we take, more conditions we get treated for. And there's only 29 people in that plan right now. So you can see the average cost a lot higher there. The other thing that I think is important on this page is in the lower left-hand part, highlighted in yellow, is in 2020, we were enrolled under Scott and White, And this reflects the average discount savings or the ability of the carrier or the provider network to negotiate price with hospitals and doctors and other facilities and things. And so during our tenure with Scott and White, we hovered in that 54, 52% range average discount. And as a result of the RFPs that we conducted in 2020, we merged that we identified some other carriers with networks that could offer substantially better price negotiations with doctors and hospitals, et cetera. So in 2021, part of the dollars in that calculation are dollars from Scott and White. Like I explained before, the medical claims that didn't get paid right away, some of those rolled into 2021. So the year of 2021 measurement of the average discount is mostly United Healthcare, a little bit of Scott and White. But you can see how the discount rate improved from 54% to 60%. Now we're into 2022. In the first 2 months, there's no more Scott and White claims flowing into the calculation. And you can see that that average discount now is at 62%. So for those of you who've been here for a while and on the court, there were times years ago where we were struggling with making sure there was enough money allocated to the health plan, and you were doing things like transferring money from your tobacco settlements and other parts of your general fund into the health plan to make sure that it was adequately funded and had a good, healthy reserve. Today, as a result of changing over to United Healthcare, and it's not as if United Healthcare healed sick people, they just helped you get better pricing. But the target fund balance that we've been recommending for years has been about $1.6, $1.7 million per year. And currently right now, your fund balance is close to $5 million. So there's plenty of money in the health plan to sustain it. There's no need for the county's part to allocate any additional monies to the health plan. And the hardest part about having a plan that's in this financial position is at some point there'll have to be a need to increase funding to the plan or changing benefits. It's just the wear and tear of inflation, which has been hitting medical plans for a long time. And of course now in the economy in general, we've got unprecedented paces of inflation. But that inflation will start to eat away at the revenue versus expense ratio. And what we have to be prepared for at some point in the future is, even though the fund balance is still healthy, as it starts to decline, you'll want to take action to keep it from just crashing right through the floor of that ratio, so that you kind of turn that curve and make it level out. So the objective would be, ideally, keep adequate funds in the plan for contingencies, and then have revenues equal expenses. There's no need to pile up a lot of money inside of the health plan. But the other thing that's I've experienced plenty of times before is it's just tough when you're looking at a report that says you've got plenty of money in the fund, but it's time to go ahead and raise contributions, whether it's from the county side or the employee side, so that you don't get into a point where you're having to play catch up like we did before. So we did quite a few years of getting things balanced out. Everything looks like it's working really good right now from a financial perspective. If we go on to the next page, you can see on these are the large claimant reports here. And so the county does carry a deductible, a reinsurance deductible of $175,000, which means that anything in excess of that threshold is paid for by United Healthcare through the contract that we purchased from them for reinsurance. And you can see in the years past, in 2020, there was a $365,000 payout under the stop loss. Last year was only $82,000, hardly any money at all. And so far this year, nobody in excess of the threshold. It's likely that we'll have some people penetrate that by the end of the year. We've still got 10 more months worth of data to go. But the good thing is we know it doesn't look bad right now, and everything's looking good. So, and there's nothing on the horizon that happened in the month of March that really changed this outlook. The following slides are just charts and graphs of moving averages. This is one that I think, these are definitely bragging rights from McLennan County. If you're going to conference. I think TAC had a conference just a few weeks ago too. But a lot of people, they get together and they compare notes. How's your, whatever you're comparing notes on health plan running. But you can look here, and that blue bar chart is the average cost per employee per month, and the red line is per member per month. But you look back to, and each one is a 12-month block of time. So January of 18 on the far left-hand side represents everything that happened in 2017. So what this chart is basically telling you is that for 5 consecutive years now, your average cost per person has continued to decline or stay flat, as opposed to most plan sponsors. You could just take this chart, flip it around the other way, everybody else's expenses are going up. So all the things that McLennan County and your HR staff are doing in conjunction with your partners are working and helping to help control costs there, plus actions and decisions and lifestyles of your employees are what's helping maintain that good ratio. On the chart that's up there now, that's just comparing the utilization by the 2 plans. The base plan, and this is a moving average chart over time. So the base plan is the red line, and the consumer-driven health plan is the green line. And normally you would see those flipped over. But typically they'll flip when there's more people in the consumer-driven health plan than inside the base plan. And so it looks backwards here, but you can see the 2 lines are starting to converge. And as more and more employees shift into the consumer-driven health plan, then from a data perspective, that gives it more credibility and more statistical probability for it to operate the way that it should. So I would think over time, we'll see the base plan rise over the cost of the consumer-driven health plan. And then if we'll skip 2 pages, the last 2,
Can I ask
3,
you a
I guess.
about page 12, before you get into your summary? Are we seeing that we have a younger, healthier workforce, or are we seeing that employees are covering the brunt of the cost as opposed to the county?
I would say your workforce, I wouldn't call it necessarily a much younger workforce than it was in the past. You have a pretty good stability. Over time, you have people age out as they retire and they get replaced by new employees coming on. But that tends to keep the average pretty low. So I'd say on average, you're right there with your peers in terms of that. I would attribute it really to just an overall healthier workforce than compared to your peers.
Okay, we're not seeing, well, we don't get the snapshot to see what employees are paying out of pocket, do we?
Oh, yes. I don't have it in this report, but there's nothing abnormal on that as well. But I can certainly get one for you.
Okay.
And if we are increasing, if our workforce is growing, more than likely we're gonna grow it at an entry level, which would be younger people possibly that could have some effect, I think.
That's true. And so when you had the latest surge in enrollment, I think that was related to the detention or corrections department. You had more, was that where you were taking it back from the private?
Right, yeah. That was
bringing
a
it
big
back
thing.
in?
Yeah.
And so, yes, we did watch that because that was a pretty large one-time block of people that came in all at once. Right. And it happened, right about the start of 2021, was it, or so?
20.
No, it was
19, wasn't it?
Could have been 19.
Oh, okay.
It was before 20. It was 19.
Yeah.
So if you were to roll back to page number 10, so that's giving you the moving average cost of whether we're looking at it per employee or per member. And so if you were to just kind of look at that bar right about in the middle of the graph over January 2020, things kind of were leveled out. They had been declining since 18. They kind of leveled out. And then just after that, it declined some. So that could be attributable to the entry of that part of the workforce. And the majority of those employees, if I remember, enrolled under the base plan when they first came on board.
Randy, how does our area compare to other areas in the state? I know that has a lot to do, when we make our forecast and things like that.
Mhm.
How do our, we're lucky to have 2 hospital networks here and things like that. How does that compare to the rest of the state?
In terms of
Cost for us.
cost, yeah. So it's a little bit tricky when you look at surveys, and I think there was a pretty detailed one that just kind of went around through the, I guess the group of counties, because I saw several of our county clients responding, and it looked like a pretty robust survey. I would say that in a couple of areas that you look really good. So your payroll deduction costs, which when you compare that against other counties, you're predominantly lower in terms of the payroll deduction costs. In terms of benefits, I'd say you're predominantly a little bit better. And then in terms of overall costs, I'd score you as lower. There are a few counties in Texas, especially down in the Valley area, Brownsville, Harlingen, McAllen, where the counties heavily subsidize the cost of the health plan. And their payroll deduction costs down there are extremely low. So for like family coverage down in Cameron County, Hidalgo, right along in there, for family coverage, they might be paying $300 per month for family coverage, which is, I don't remember your number right off, but it's probably at least half of what you pay here. So down there, it's heavily subsidized. And then also a thing I've noticed in that part of the state is a lot of counties there run their plan at a deficit. So kind of like what we experienced. And rather than fix the deficit by matching the county's contributions to the actual expenses, they're just in the habit of kind of doing what we did here for a while, which is just transfer money from the general fund over. And some of them I've seen about 20% of the health plan budget gets funded by the general fund, but they're just kind of stuck in the ways they're not concerned. They zero out the plan every year. It's just, I think it's better when you can see it all in that one account on your budget, as opposed to thinking this part is the health expense and every year I'm going to take some money and just move it over there. So it's going to cost you the same amount of money. It's just the way that they budget for it. But overall, and I'll get a copy of a survey for you to take a look at on the benchmark there as well. But every time I've seen it, you score really well against your peers. But there's just these few entities, down on the southern part of the state that kind of wreck the curve on the payroll deduction side. From an average cost side, this part of Texas is not the highest average cost area, but it's pretty far up there. Some of the lower cost areas for healthcare are the Valley and far west Texas. But anywhere along I-35 from Dallas all the way down to Laredo, is it? That's pretty much a similar cost area until you get south of San Antonio, then costs start to decline. And then when you go east towards Houston and southeast Texas, that's the highest cost part of healthcare in the state.
Thank you.
Sure. So if we go back to page 14, so this was a slide that we spent a lot of time looking at in years past too. This just shows you the ratio of money coming in and claims dollars going out by the two plans. So the base plan accounts for 68% of all revenues, but only 64% of the cost. So if you were just looking at it as an insurance company executive, you might say, this plan's profitable, or it's right on target, we're not losing money. Rates that we charge are commensurate with the expenses that we're covering. Under the consumer-driven health plan, it's flip-flopped just a little bit of the way. So it accounts for 35% of the revenues and 31% of the cost. But again, there's fewer people in that plan. And you can see on the bottom, in terms of employees, 353, almost half of the number in the base plan. So if those two were statistically equal, then we'd probably see these two lines or these two measurements more in line with parity. On our next page, this is just the math behind the forecast for the medical plan. And the key points in this one too is this is just taking your revenues that come in compared to the expenses that go out. And there's an assumption of a 7% pace of inflation year over year. So again, our current rate of inflation inside the plan is just below 5%. So in our forecast, we're using 7%. It's a little conservative, a little bit higher, but things can change quickly inside the health plan. But you can also see down near the bottom, before it gets into the blue part, the reserve target or the money that you want to be holding in your contingency reserve inside the health fund. For this year, we have it recommended to be $1.7 million. And for next year, $1.8 million. But if you look down at the bottom portion, at the very bottom line in the middle, that's the current year we're in, we anticipate your fund balance will be about $5.8 million at the end of the year, well over the target that you have. And then over at the end of the following year, we would expect it to be about 5.7 million. So hence the need to not have to throw any more money at the health plan. So another thing that you can look at here too is if you look at that first blue line near the top, these are our revenues coming in. So the rates and contributions from employees in the county equal about $8.1 million in a year. If we look down over on the right-hand side, just below the blue at the bottom, the total projected plan costs for next year are going to be about 8.2 million. So you'll see that's the beginning of the start of this drifting down inside the fund balance. You know, the fund balance drops about $100,000 based on those projections. And then the next year it might drop by 200 or 300 or 400. As it starts to approach that threshold that we don't want to cross the minimum, we'll need to make some adjustments in revenues versus expenses to close that gap so it just doesn't come dropping through there very quickly. So things look good overall in the health plan.
Can I ask something? And it's kind of going back to page 8. On our seniors, on our retirees, what is our contribution to them? Do we pay, like those who are vested and they stay on our health insurance, we just continue to pay the county's portion on them, or do we pay all of theirs?
Yes, you have. So it's kind of like being on a Jeopardy show sometimes. I think you have the same schedule of contributions for retirees once they qualify and are eligible to retire. I think at one time you might have had a different scale based on years of service, but I think it's the same contribution for all retirees once they pass the threshold. And then
I'm sorry, go ahead, Randy. Go ahead, Randy. I was looking.
No, I can answer.
Okay.
So we do contribute the $559.90, which we do to our regular employees. For our retirees that are under the age 65, as long as they've had 20 years of service and have been here since January 1st of 2009. And then once they turn 65 and they go on Medicare, we do pay their supplement to their Medicare at 100%. So
Okay.
currently is $197 and some change is what that supplement costs through United Healthcare.
Okay, so being vested, they still pay what they were paying as an employee. We just pay the county portion?
We pay the county portion. Their portion is inflated a little bit, and I think that is based on the numbers that Randy provided as far as the cost of healthcare for a retiree is a little bit higher. So the base health plan for an employee is $28 and some change per month. As a retiree, that does go to $85.96 per month. And he might be able to explain that math a little bit better than I can.
Do we have any retirees and we're paying their full premium? And I say this because I was in a meeting and I thought that they paid a percentage and we paid our county portion continuously after they retired if they were vested. And the retiree told me, no, they pay all mine.
If they are under 65 and choose the high deductible plan, it is still at zero cost to them.
Okay.
Because the county portion is still the same as when they were employed.
Okay. Do we have anybody over 65 and maybe they retired some time back and before the 2009 rule hit, we're paying their full retirement? Do we have anybody we're paying their full health premium?
For over 65, yes, not under 65.
Yeah, over 65.
Correct.
And before that 2009 rule, so we're probably paying some full premiums?
I would have to check on that.
Okay. I wasn't sure, and I wasn't gonna tell her, no, we weren't. But she said we were, and I just wanted to get a refresher in my head. Okay. I'm sorry, Randy, that was a Stacy question.
That's okay. I've got it here somewhere. It's just a matter of pulling it up and finding it.
Okay, thank you.
So Randy, how long have we had our contributions at the level, our employee and county contributions at this level? Is it 5 years, something like 4 or 5, maybe even?
I've been here 6 and it's still the same.
So it may be even 7.
Yeah, I think we've been stable for at least 4 or 5 years now.
Do you find that anywhere else?
Rarely. So things, in the county of El Paso where I live has been my longest client since 2003. And then, I guess from about 2014 to 2018, we enjoyed the same ride that you're on right now, no changes in contributions or premiums for either the county or employees. Unfortunately, they've had a run of bad luck here over the last couple of years. Kind of started with the pandemic, and some of it was related to COVID-related claims. But it just seemed like everybody started having low birth weight babies, heart attacks, and the county of El Paso invests a lot of money in health and wellness. And in fact, during our period of healthy reserves and good utilization, they accumulated a large fund balance and built a gym in the county courthouse for employees to be able to use. And they've got a wellness coach there to help people with their diet and nutrition, things like that. But over the last couple of years, they've made up for all the time that things were so rosy. And that's where having the healthy fund balance is good, because if that should happen, you've got the resources to accommodate it without having to impact the other parts of your budget. In their case, they were skating on thin ice when they hit that rough patch, and it ran the reserve fund down to 0. And so they're back in a position over the last 2 years where they've been infusing some money in there, but things look like they're starting to turn the corner there. But it's pretty rare that you can go that long to have that much stability inside of the health plan. So the last forecast page is for the dental plan. And the dental plan is also self-funded, but the dental plan is paid for by employee contributions. And at the start of 2021, we went from offering just one single plan of dental benefits to 2 different options. And so the differences between the 2 plans are that if you do the buy-up version of the dental plan, you get some adult orthodontia and you get some higher limits on your calendar year maximums for dental care. So if you've been to the dentist lately, it doesn't take long. A lot of dental plans, like your one that you had for ages, had only a $1,000 calendar year maximum benefit. And you can rack up a $1,000 bill at the dentist in just 1 or 2 visits. So part of the changes made in 2021 were to raise the calendar year maximum so that you could get more benefits from the dental plan during the year. And for employees that wanted to, they could buy up to an even higher threshold and also gain coverage for adult orthodontia. Child orthodontics are covered under both of the dental plans. And so the plan used to be fully insured, and we moved it to a self-funded arrangement a few years back. And that's worked out really good. So the fully insured version of the dental plan a few years ago wanted to increase the rates by 10%, and we changed it to a self-funded format and held the rates stable. And they've been stable until 2021, and we raised them a little bit to accommodate the higher calendar year maximum, and then the buy-up plan as well. And in looking at this forecast, dental claims expense don't inflate as quickly as health claims expense, but we are seeing an increase in utilization. And again, if we look down at that bottom right-hand corner, in order to keep a good fund balance for the dental plan, and you can see what those numbers are in the blue section, is we started off this year with $129,000 accrued in the fund balance, and figure that it'll be about $106,000 by the end of this year, and that's still fine. It's still greater than our target of $87,000 for the fund balance. But as we go into next year, if we keep the same rates, then we would project that you'll still have a positive fund balance, but it'll start to slip before that desired threshold. And so if right now for this one, it looks like it would be prudent to call for about a 5% increase in funding for 2023. You don't need to make that decision now. That's not going to be a budget impact to you. And I did look at the March data that came in, and again, the dental plan numbers are not really changing. It would still call for about a 5% increase. But we can wait and see a few more months of data. So dental claims definitely did have a lag effect due to the pandemic, which surprises me because one of the cleanest places you can go is to a dentist's office. They've had good sterile environment prior to the pandemic, but for whatever reason, people stopped going. And then when everything looked good about March of last year, everybody started going back to the dentist again. So this one could be one where it's just a temporary surge because, again, all of these measurements are looking back 1 year. And so that 1 year captures right about the time the surge happened. So if we wait a few more months and get closer to, we want to make sure there's adequate time before open enrollment, which will start in October, but maybe around July or August, revisit the dental plan, make a determination if it looks like we should increase the funding of that there, and then go ahead and set that for the next year in the communications. So the county doesn't pay for the dental plan, and it would only pay if there wasn't enough money in this account. So that's what we want to do. It's a voluntary plan. It shouldn't have to have the county bail it out. So this one would be prudent if necessary to keep that fund balance closer to where it is, but no need to take action right away. We'll just keep an eye on it and revisit that as we get closer to time for open enrollment in the start of the next year. And then that would conclude the report and the update.
All right. Thank you, Randy. Any other questions anyone would have? All right, is there a motion to approve Randy's report for recording purposes?
Motion to approve. Second.
Have motion and second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass. Thank you, Randy.
Thank you. I'm happy to come spend some dollars here during travel and tourism week. Help contribute to the economy. It's always great to be here.
Yeah, we appreciate it. Thank you very much. Okay, Dustin.
All right, Judge, we can go back up to item G, bids, RFPs, RFQs. G1's discussion and or action regarding bid on roadside cleanup. Ken?
Sorry. I come to the court, we had the bid out, and on the due date and time, we did not receive any bids. I come to court to discuss this a little bit. I had a phone call the afternoon before bids were due the next day, which was a little bit late to respond in that this particular person said, Ken, we're not going to respond to your bid. It looks like that you have in there that you can end this contract with a 30-day notice. We can't afford to gear up with equipment and people and not have a clear length of time that we can recoup our investment. And so I come to the court. I can reissue this bid, but I would have to have at least a 2-year kind of guarantee of work. And 3-year might even be better, that we might get people to respond to the bid. And again, we sent this out to a lot of people and didn't get anything. Per Jim's prompting, I've tried to contact Goodwill, and I've got phone calls into them, and the person that's supposed to be over that cleanup kind of crew hasn't returned my phone call. But I will continue to pursue that and see what I can get from that. I have heard that through Jim, that he's seen them out on the roads. But I'm kind of thinking, I may be wrong, I'm thinking they may work kind of like adult probation. They take people that need to work off their community service, and they're running a crew like that. But again, I haven't talked to the man to find out specifically. But as far as bid goes, if you're willing to, again, this whole discussion when we could get inmates back and when we could take those back over. But if I go out for the bid and make a commitment for a couple of years, then you know, we're kind of stuck. Though a couple of years is not a long time in county years. I just wanted to see what y'all thought about that.
So what's the chance of us reinstituting the traditional, the old program we had?
Yeah. Quite honestly, I think that's kind of gotten lost in all the COVID and transitions at the jail. I would hope we could, but I do know this, we've got to do something soon. It's becoming a problem. And so we either need to figure out a means to get people to respond to the bid, and if that means 1 or 2 years, that may be what we have to do, but it's truly becoming a problem. I'm getting a lot of frustrated phone calls.
What if we do a multi-year contract with if we withdraw, we pay a cash payment? Something like that.
Probably the best route. I don't know where we stand on the inmate crews, just because it wasn't just COVID that was part of the issue.
Right.
So the fact that we weren't getting people that were in long enough to get trustee status.
Yeah.
We don't know where that's gonna go in January.
Yeah.
So I would just say that we probably need to look at moving forward, figuring out how to get them to respond to the bid, and then a payout option.
What's cost? What do you think you got an idea what it would be?
I really don't. But you know, one thing I have to point out, I can't allow one court to speak for the next court, and so there'd have to be a non-funding clause or non-appropriation clause in the bid anyway.
That's right. Yeah.
And again, at non-appropriation clause, there can't be any penalty for that. And I can let maybe Dustin or I think Mike's was on the line, but again, it's better than a 30-day out.
What is the question, Ken?
I'm trying to extend out a contract for maybe at least 2 years for roadside cleanup. But even if I do that, I would have to have a non-appropriation clause.
Right. So you'd have to have a non-appropriation clause in the contract.
Yeah.
Was your contact aware of that, or did you make them aware of that?
Well, because I had the 30-day out, I did not have a non-appropriation clause, because that would just mean we call them and say, we're giving you a 30-day notice, we're ending the contract.
Well, I mean, honestly, I could see where we need this for a while, on top of the inmate crews.
So what about a 2-year deal?
Non-appropriation clause. That's what I'm hoping will work. I mean, that's my next option. And again, I'll to continue to try to pursue goodwill and see if we can't find something there. But, and again, it's a bit of an investment because we're talking about 4 different precincts with 4 different crews. And so there's maybe a minimum investment of 4 pickups with trailers and at least 3 people per crew, so.
And Ken, if you keep the 30-day out, you don't have to worry about the non-appropriating for a 2-year contract.
Well, that was my problem on this original bid, is I had that in there, and at least one company did not want to respond because they didn't want to make that kind of investment, and then we could just call them and end the contract with a 30-day notice. I'm just trying to find a way that maybe this would work out. If someone would actually submit a bid.
Right. Well, if you do the non-appropriation clause, they are assured a fiscal year.
Yes, sir. Yes, sir.
Ken, we'd be happy with just a couple of days a week. If we could share with another precinct or something, we wouldn't have to have 5 days a week, I don't think. Now, some of the...
Well, that was part of my question before. That could reduce down the amount of money that they have invested.
Yeah, that they have to expend to get geared up.
Shorten the number of days.
I'm with you. A presence period would be
just
warmly received.
Yeah.
But I don't think that that's not really solving the problem that we have necessarily with this situation with the bid. They want as much work as they can get.
Yeah.
So and like I said, I think that we could go 2 years easy and still have trash to pick up.
So what about a 2-year contract?
I'm completely
and
fine
two
with
and
that.
2 crews to represent two precincts 5 days a week. What about that? See what I mean? I mean, it's kind of addressing.
So what were we talking about 4 crews before, or just?
I was talking about 4 crews, 4 precincts, 4 crews.
I think
5 days.
initially you could keep 4 busy.
Yeah.
But I think after that, and I don't think we should look at it, if it's easier, just put a crew on one side of the river and a crew on the other side and have them work nonstop. I think that would still be adequate and catch us up. Do y'all?
Yeah.
Feel the
We
same?
can always come back and beef it up.
Yeah, that would be a true statement. We could leave room to increase it if we needed to. Okay, I will work to revise that bid to reflect what we just talked about.
Okay.
But I wanted to tell you what I was up against. Now, that was only one company that was providing me that information.
Well, it makes sense. I mean.
Yeah, it does make sense.
I can see where they would pause at that, so.
Okay.
We don't want to starve them out. We want somebody that's making money but doing a good job, and so we can move forward.
Well, I've never asked for this, but I could ask you this as well, because we already approved a previous advertisement and everything. If you'll go ahead and give me that latitude to submit that advertisement, I could get that out a little bit quicker than having to come back to the court for you to approve the advertisement and then get the bid out. It saves a week or 2.
Okay, thank you.
On the bid process.
All right, I'll entertain a motion in that regard.
What's the motion?
To allow me to go ahead and advertise.
I make that motion.
Second.
All right, we have a motion and second. Is everybody clear what the motion is? It also allows them to advertise. Okay. All right, any other discussion? No other discussion, all in favor say aye. Aye. Oppose? Pass.
Thank you.
Thank you.
G2 is authorization of subscription quote with SR Fax, digital email fax service for juvenile probation. Lisa?
Yes, sir. What we have here today is a request to replace the medical fax machine in the juvenile probation department. We've got irreparable issues for that on the PBX system. So our options are either to go through AT&T and get a landline, which would run at a minimum $540 a year. That doesn't include the associated taxes, or we can move to a digital fax service, which is the recommendation today. So we're looking at SR Fax Services. They do have a service that supports healthcare entities. They are HIPAA certified, and the rate for this service would be $91.20 annually. This would allow an unlimited number of senders, notification emails, and login accounts. It includes up to 200 pages per month. Any additional pages would cost 5 cents a page. There are no contractual obligations, just the recurring service fee. There is a one-time setup charge of $25 to port their existing number. That's about a 30-day process. The account setup is through their website. This also requires a credit card charge of $1 to authorize the account during sign up. Then the amount is credited back. At that time, we could issue a PO for the subsequent billing periods, and invoices will be issued so that we can pay by check. I would also like to note, due to the nature of this being a HIPAA-related service, there would be a business associates agreement that would be presented to us if the account is approved and created. I can bring that back at the next agenda.
Okay, any questions?
Judge, I understand that they have the funding available in their budget, correct, Lisa?
Oh, yes, I'm sorry, I forgot to mention that. Yes,
And
they do have
because-
that in their budget.
And they're requesting that they get this service as soon as possible because they have one of their, I think, machines down. Is that right? It's no longer
That is
operable?
absolutely correct.
Yeah, my motion would be to approve the recommendation.
Okay, I have a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Aye. Oppose? Pass.
Thank you.
Thank you.
Under item H, contracts and local agreements, H1 is authorization of service agreement with CTWP for copier for Highway 6 jail. Ken?
Yes, Highway 6 Jail purchased a copier. This is the service agreement to go along, or support agreement to go along with the copier. It's in the amount of $360 annually for 12,000 copies. Overage rate would be 0.008 cents per copy. This includes all parts, service, labor, and black toner. It's for a Canage Image Runner DX617IF.
Okay, and this is in line with other agreements that we've got.
Yes, sir.
Okay. All right. What's the pleasure of the court?
Motion to approve?
Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye. Aye. Oppose? Pass.
Under item I, capital improvement and construction projects, I1s regarding the Mart Water Project street repair agreement with the city of Mart, authorization of third and final payment request. And Judge, I believe the recommendation is to keep this deferred.
Yeah, I'll make a motion. We defer and we defer. If you have any questions, you can ask Mr. Dunham, but defer until they're further along with the project.
Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Oppose? Pass.
Under item K, grants and grant proposals, K1 is the American Rescue Plan Act. I know we'll have a discussion with Tom Ray. Judge, you want to hold that for a little bit later in the
Let's
agenda?
hold, please.
There's a few action items here, or a few items we can discuss really quickly. K1A1 is discussion and or action on ARPA funding requests. K1A1 is the Texas State Technical College Training Center. And as we talked about before, training centers are specifically enumerated as being eligible in the final rule. And we've been visiting with BKD on this eligibility. There is another layer. Capital projects that are over $1 million take a written justification where you have to look at other alternatives and say why you need this new facility. So that's something we'll be working with TSTC and BKD on, but just wanted to provide that quick update to the court. Under K1B regarding the professional consulting contract with Lockwood, Andrews and Newnham Incorporated, authorization of professional service invoice. Number 5, this invoice totals $7,144.65. And it's through April the 15th.
All right, any questions? Not, is there a motion to approve K1B?
So move.
Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
We can hold K1C till later. That's the discussion on the arsenic mitigation projects. K2 is regarding the bipartisan infrastructure law. Just as we've been talking about, we're beginning to look for a grant management firm to help us as we navigate through this. And earlier today on the consent agenda, there was approval of a publication for an RFQ for that grant management services firm that will help us. So that ad will run in the next 2 weeks. K3 is regarding the Bureau of Justice Assistance Patrick Leahy Bulletproof Vest Partnership Program, authorization of grant application submission for FY 2022. This is just the annual grant program that we apply for, and we just need a motion to approve that grant application.
All right, any questions for Dustin on that? If not, is there a motion to approve?
So moved.
Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
K4 is regarding the U.S. Department of Treasury Emergency Rental Assistance Programs, authorization of advanced funding for program administration for ERA2. EOAC has requested advanced funding. Francis and I have reviewed this, and it is reasonable. We have received the additional 30%. We're still waiting on the final 30% from the Treasury, but we have received 1.8 million from the Treasury, and that's what is being requested to transfer to EOAC.
Okay.
And that exact number is in your packet, sorry.
All right, any questions on that?
Motion to approve.
Second.
We have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
K5 is regarding the Bureau of Reclamation Water Smart Grant, and this is our agreement with Lockwood, Andrews, and Newman's authorization of professional service invoice number 6. This one totals $1,800 for engineering services through April the 15th.
All right, any questions? Not, is there a motion to approve K5?
So moved.
Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
Under item L, department and office specific requests, L1 is purchasing authorization of online auction with Renee Bates related ad in order declaring certain property as surplus and authorizing the disposition of same. Ken?
Yes, sir. We have 24 lots ready to go to Renee Bates for their online auction. We have lots in purchasing, some at Cobb's Drive and some at the radio shop. If approved by the court, the auction will tentatively schedule to begin on May 11th, 2022 and close on May 25th, 2022.
All right, what's the pleasure of the court?
Make a motion to approve.
Second.
Motion made second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
L2, Health Services, authorization of request to close office for half day annually. Heather?
Yes, good morning. So this is a request to be able to host a team building exercise annually. So I'm asking that we have approval to close the office for half a day once a year between the months of March and June. And that, we'll plan in advance to make sure that the public's aware the office is going to be closed a particular afternoon. And that's it. I can answer any questions you might have.
Okay, and that's for training, staff training.
Yes, sir.
Okay.
Staff training and team building.
All right. Okay, is there a motion to approve L2?
So moved.
Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass. Thank you.
Thank you.
L3 is Road and Bridge Precinct 4, authorization of equipment trade-in request. Ken?
Precinct 4 has a need for a little bit bigger trailer than what they currently have. The cost for the new trailer would be $23,000. They have a smaller trailer that's somewhat shorter that they'd like to trade in for on the purchase of this new trailer. Lloyd Trailer Company is offering $12,000 on the trade-in. In the local government code, chapter 263, under 263.152, the Commissioners Court may offer the property as a trade-in for new property of the same general type if the Commissioners Court considers the action to be in the best interest of the county. We respectfully present this information to the Commissioners Court for your consideration.
All right, any questions?
I do a quick comment, Ken, was asked yesterday. So on equipment, quite often with regards to vehicles typically, in this day and time, you're probably gonna get more on a trade-in than you're gonna get on putting in an auction. So are we evaluating that on pieces of equipment when we have a request for a new one that's gonna be replacing something?
Well, generally, I haven't been trying to evaluate that. We can come back and do that, and at any time that we're asking for a quote for new equipment, we can ask what the trade-in value, and let me just, most of the time, y'all are initiating those conversations, but you can always ask what the trade-in amount would be for a piece of equipment that you already have.
I just know the prices are so high right now, you can get pretty much top dollar on that, so I just want to throw that out as something to take into consideration.
You know, you're absolutely a good comment, because again, people are selling their personal vehicles and getting more money than what they paid for the vehicle. So just, it's a good situation to bring.
Thank you. I'd make a motion to approve.
Second.
I have a motion and a second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Passed.
Under item M, additional items for discussion. M1's discussion and/or action on matters regarding COVID-19. Judge, I don't believe we have anything this week.
All right.
M2 is selection designation of public members of the Salary Grievance Committee regarding the FY23 budget. I don't believe any action's needed at this time. M3 is the Greater Waco Chamber of Commerce Monthly Economic Development Report for March 2022. And Judge Chris was on earlier and she had to leave for a 10 o'clock meeting. We can either, she'll try to join back if she finishes in time. I don't know if you just want to hold this or go ahead and approve it.
Well, if she comes back and wants to add anything, she can, but the report's in the package and should have a chance to review it. And I would recommend the court consider approving that report for recording purposes. And I'd make that as a motion.
Second.
Motion made. Second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass.
M4 is authorization of appointment to the TIF number 4 board. And Judge, we actually are still waiting the interlocals from the city for our participation in TIF number 4 and then the extension of TIF 1. So we can either defer this at this time or pull it with no action.
I would say we would, let's defer this. I'll make a motion we defer.
Second.
I have a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
M5 is regarding the Local Provider Participation Fund, the LPPF. M5A is authorization of an IGT from the Supplemental Payment Program known as Comprehensive Hospital Increase Reimbursement Program. That's the CHIRP. And M5B is under the Rural Access to Primary and Preventative Services, the RAPS program. Heather?
Yes, so the first one, our CHIRP IGT request came in late last night, and the exact amount of that would be $6,644,051.33 with the settlement date of this Friday, May 6th. And then the RAPS IGT request is for $245,347.24. Again, same settlement date of this Friday, May 6th.
Okay, any questions? What's the pleasure, court?
Motion to approve the IGTs.
Second.
I have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
M6 is authorization of State of Texas Federal Surplus Property Program application for eligibility and related documents. And Judge, this is in court, this is what we approve, I believe, every 3 years. It's the Federal Surplus Property Program where those federal surplus property is transferred to eligible organizations for just a small handling fee. And we just need to update our application with them.
Okay, is there a motion to approve M6?
So move.
Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye. Aye. Opposed, pass.
I'm going to share my screen real quick for the next item. Can y'all see that okay?
Yes, sir.
So M7 is authorization of space allocation and office renovations remodel for the specialty court. As you know, we've been making moves in anticipation for moving the specialty mental health court over to the first floor of the annex. So this is a layout of the annex. On the left is the visiting courtroom. On the right is the alley, and the jury entrance is right here. Juror entrance is here. The offices where the CPS court had previously held with Judge Munkowski and Marcus Crosby, and then the small hearing room, those will be designated as space to be used by the specialty court, and Judge Hodges will office out of here. The office that we last court session designated as flex space from the district clerk's office. This is the office outside the visiting courtroom. This will become flex space to be used by the specialty court. And TJ, did you want to add anything about the budget on this?
Sure, yeah, and we can go over the budget real quick, if you can pull down. So this is the basic preliminary construction budget that we put together. The group that's wanting to go into the space really wanted to update the finishes. So it's majority of it's just paint, flooring. Actually, the saw cutting of the new doorway will get pulled out. They determined they do not want to install that door. So there are some prices in here that will fall out of the main budget. But we'll put it together as an amendment and send it to court. But we probably would like for the court to decide whether you want it to be a 401 project or come out of something additional. But Francis may have some more input on that.
Okay. All right, in regards to this action, notwithstanding where it comes from, the funding, is there a motion to approve this plan?
I have a quick question.
Yeah.
What is, what's in these spaces right now? What's in that?
So they are currently, the small hearing room that was used by CPS is still set up, I guess, as a hearing room. I know Amy Lowry has been using it as a group room. And then TJ, is there just furniture in those other areas?
That's correct. It's just empty space right now.
And that happened by relocating Judge Munkowski and Marcus when we approved moving them over to the third floor of the courthouse last month or so.
Any other questions? Is there a motion to approve M7?
So moved.
Second.
There's a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass.
Item M9 is discussion and interaction regarding the 2022 Texas Association of Counties Risk Management Pool Employee Safety Programs. M9A is regarding law enforcement, and M9B is regarding road and bridge building maintenance. This is the program TAC started several years ago that we've participated on. The law enforcement portion, our spending limit is $10,633.79, and David Ives has offered to help administer this program as he's done in the past few years. And then under the road and bridge and building maintenance, our spending limit is $10,633.79. And this is one that Chrissy has helped with in the past. And we would just request that if, when she returns, if she can assist with this program as well.
Okay, any questions or comments? Is there a motion to approve M9? Let's say it's M9B and C, right?
A and B.
A and B. All right, is there a motion to approve M9A and B?
So moved.
Second.
All right, motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
M10 is authorization of appointments to the Waco Metropolitan Planning Organization Technical Advisory Committee. Judge and Zane?
All right, Zane's coming up. That last minute change, I think.
Yes, sir, Judge. Found out that Jim Jaska is a member of the MPO Policy Board and is ineligible to be on the, to represent the small north cities for the Technical Advisory Committee of the MPO. And so with that being, I have reached out to Beverly Hills and to Golson, and am awaiting to hear back from them.
In West, right?
I have not yet reached out to anyone from Leroy, Leroy or West.
Okay.
So now for the South cities, I'm recommending Chief Tom Dixon, who I've spoken with, and he's agreed to be the representative for the South cities.
Yeah, he'd be good.
Who's he?
The chief of police for Lorena, Tom Dixon.
How did you come up with your recommendations? Did you reach out to the other small cities? Or you just?
Well, I don't have any contacts for Leroy. I did have a contact for Golson and Beverly Hills. I do have one for West. I have not reached out to that person yet. I
I was looking at the South cities.
South cities. For Lorena, Chief Dixon has been coming to the technical advisory committees on a constant basis, and he's engaged. And so it made sense for him to be the representative if he wanted to be. And I reached out to him, and he said he would be interested in doing that.
But he's representing all these other entities.
And he understands that.
You didn't, no. My question
Oh.
is, but you didn't make any contact with Riesel or Mart?
I did not. No, I don't really have.
Are they
if you have-
represented on the MPO?
Excuse me?
Are they represented on the MPO?
They are currently represented by county, by me and the judge. Yeah.
Okay, how do they get then, I guess, updates? Because I don't have a clue what's going on with MPO until I read the newspaper. But how are they updated about what's going on? And if he's gonna represent them, does he know them? I mean, where's the connectivity between the representative and then the entities that they're representing?
I would expect for the representative to reach out to the mayor or the city manager of these smaller cities.
Does he know to do that?
I would talk to him about that, and I would imagine the MPO director would talk to him about that.
And they, correct me if I'm wrong, but they have the ability to attend all these meetings.
They do,
Oh,
and
yeah.
They get notice of it.
They get the invitation all the time. They
Yeah,
just
they-
don't,
I guess that's what I'm asking.
they don't attend.
Yeah, and I think where Zane and I were looking for somebody that had an interest and had a knowledge about what was going on, but some of these communities just do not participate in what's going on in overall, but they all have access to the website, which, all information is out there, just like it is for the county. MPO does the same thing. There's a vast amount of information there, so if they have an interest in it or they have some need to come to MPO to request certain considerations through that TxDOT would allow, then they can do it, but.
And I guess my questions come that there wasn't anything in the packet except that you recommended these two names. And I didn't know who they were. And so I just had questions because there wasn't any information in the packet.
Right. So the MPO sent a letter to all of these cities, to the mayors, I believe, all of these cities, requesting them to either put forward their name or somebody that they recommend to be a representative for these cities. And they received no response from any of these cities. The MPO also sent a written letter and emails, like they did the smaller cities, to the county judge and to me. And so on behalf of the county judge, I reached out to a few of my contacts. For Lorena, it was Chief Tom Dixon, because I've sat beside him in the TAC committees before. And then I also reached out to, I thought Jim Jaska would be a appropriate person because he comes to the technical advisory committee, but apparently he's on the policy board,
He
which
is.
so
He comes regularly.
therefore he's ineligible to be on the technical advisory committee. So then I've reached out to a couple other folks. One was with Beverly Hills and one was with Golson. But for the smaller city, for the south cities, because Chief Tom Dixon has been engaged for the past few years at least. Just made sense for him to stay engaged. And it's a yearly thing, so after his term is up, you know, somebody else can come on and represent this.
And for some of these smaller cities, they truly don't have employees, so somebody's gonna have to take off from work.
That's right.
To go to this meeting, and I would hate that burden to fall on them to know that, hey, I'm gonna have to take work off now, or take off work to go. I do know Tom will do a good job, and he is a networker for sure, so I have confidence in that.
And I'm not saying I had a problem with them, I just didn't have any information. When you looking at the north cities, are you gonna look on the eastern side? Because so far it looks like we're heavy on the west, especially if you're getting a guy out of Lorena.
If you have contacts that you can
No, I thought you
forward me.
said you had reached out to, I thought you had called, you said Golson and Beverly Hills, although Beverly Hills is kind of on the west side too. I know they're south, they're north, but they're on this side of the.
I reached out to the
Yeah.
individuals I had
Yeah.
contacts with, that I've had dealings with in the past.
And I guess I need to go up on that website, because see, maybe that's why all the development with our interstates and our highways are showing up over on that side, because that's where all the representation is.
But you did say the reason you're involved is because they sent out and received no responses.
That's correct. They emailed and they sent paper letters.
April 7th, and we received a letter that
Right.
went out and it's asking us to help out, but it lists every city on here, and so they're all notified. So we shouldn't
Right.
have to drag them screaming and kicking in here to try to serve our community. You take, for example, some of the bigger ones like Belmead, significant interaction with TxDOT. Their representative, I've been on it for 10 years, I've never seen him show up at a meeting,
Not one time.
Mr. Gibson. And,
They have two, don't they? Doesn't Belmead have two representatives?
Just one.
I think.
Just one.
Just one? Yost is not on there?
No.
I don't think so.
He's not on there?
No, he's not.
I want to make a point. This is just the Technical Advisory Committee is all we're talking about, which is a subcommittee of the MPO.
That's correct.
Every city will still have their same voting rights with the general MPO itself. So this is just a small subset of the MPO that we're talking about.
That is correct. Yeah, the FHWA has the funding, sends it through the DOT, the state DOT, TxDOT for our state. And then TxDOT and the MPO, Metropolitan Planning Organization, works together on how to utilize that funding. They look to the Technical Advisory Committee for some assistance, because they're usually the people, individuals, boots on the ground, if you will, that are knowing where the need is. But it's ultimately the MPO board, policy board, that makes the decision on how that funding is utilized and spent. So, of course, I-35 took a lot of the funding
Well,
previously.
my point is, if you have a general MPO meeting and you have trouble getting people there, I can imagine for a subset, how difficult it is to find someone willing to show up to serve also, so.
Right.
That's an
Thank y'all for doing
interesting
that.
point he makes. So every city in the county is represented on the MPO?
I believe so, yes.
Every city? Okay. I can't speak to why Belmead is not there. It might be the point that Commissioner Perry made, that smaller cities have people that work. But just looking at what I got in front of me, I was just wondering, just to make sure that if they're gonna be represented, that they were connected to it. But if they have a seat on the MPO,
Yeah, they make the decision on the MPO board.
okay.
Yep.
Okay. So, we've got one selected, we've got to we need to do it by the 5th. Their deadline.
Well, so I will carry the other small cities vote until we can get somebody else put forward, a name put forward.
Okay, thank you.
So you'll still represent the northern cities, and Chief Dixon would represent the southern cities?
That's correct.
Okay.
Okay, what's the pleasure of the court?
I move to approve.
Second.
Have a motion, second, any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you. All right.
We have nothing under item N, Americans with Disabilities Compliance Project. Under item O, McLennan County Venue Project. O2 is regarding the construction manager at risk agreement with John W. Irwin General Contractor. O2A is an authorization of addendum to that construction manager at risk agreement with John W. Irwin General Contractor. Mike?
Well, this is consistent with how we've done this project. We learned early on that setting a GMP for the whole project doesn't really work. And it was better to do GMPs on packages. This is the demolition package to demolish the old Paul Tyson Field and the old golf range, and to leave it in a state where it's ready to accept improvements, being the barns and the equestrian facilities. We have our CMR, John Irwin, and we prepared this agreement. Actually, when we looked at it, the fixed fee is 2.3, which is what they 2.3%, which is what they bid. And I was feeling kind of bad because let's assume it's a $500,000 cost. That puts them making $11,500 off a $500,000 project, and being at risk to pay for it if it goes over. So we talked to them about it. We didn't want to take advantage of them, but they said that they knew that there would be pieces of the project that they might lose money on when they committed to the 2.3%, and that they were going to do it for the 2.3%. And so I respect them for that. Another probably motivation for them is they're going to be building the barns and the equestrian facilities whenever we actually are able to do that. So there's a motivation for them to leave the site in a position to just start those facilities up and not have to do a lot of actual site work. So in addition to demolition, they'll be doing a lot of grading and stuff like that. So this is the addendum addendum package for the demolition of the Paul Tyson Field and the old golf range.
Okay, any questions?
So this doesn't have to be rebid or?
No, because this is part of the overall project. They're building the project that's going to set on this. And our contract with them is to do all parts of the project that are necessary to create the venue project.
Well, that's 2.3%.
Yeah.
Now, I don't think anybody else is going to give us 2.3% either.
Well, I guess my question, Mike, is who's actually doing the demolition? Has that been bid out? Has that been bid, or is that?
Well, Irwin will hire subcontractors to do it, or they could do it with their own forces. But what happens first is that Irwin will get with the engineer, Walker Partners. They'll walk the project, and they're going to work together to come up with a guaranteed maximum price to bring back to the court. If the court approves the guaranteed maximum price, they'll get started with the project. If not, then we'll keep working on it until we get a guaranteed maximum price. But based on our good relations so far, I don't think there's gonna be a problem coming up with the guaranteed maximum price.
So the 2.3% is what they're charging us to take on the risk of the project.
To do the project and to take on the risk of the project.
Yeah,
And I mean, well, not to do the project, we still pay.
Yeah,
the
the
actual
2.3
construction.
the 2.3 is strictly the risk.
Right, it's their risk and profit.
Exactly.
And we'll just pay the construction costs, not marked up. And that's how we do all of our CMARs, is we make clear that you can't mark up the labor or materials, and your sole fee is the fixed CMAR fee. Well, in one like this, they're gonna take a hit on that, but they said they were expecting that there would be smaller parts that they would have to take a hit on to do the bigger parts. And I appreciated that.
But today, all we're voting on is the CMR.
What we're voting on is the addendum to the CMAR contract. And our interpretation is they are the CMAR for everything having to do with the venue project, all the work. And this is just an addendum to the main CMAR contract.
Any other questions?
Bless you.
What's the pleasure, court?
Make a motion to approve the addendum.
Second?
Have a motion second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith?
Aye.
Commissioner Miller?
Aye.
Judge Felton?
Aye.
Commissioner Jones?
Aye.
Commissioner Perry?
Aye.
Pass.
03s regarding the Area B demolition project, professional civil engineering services proposal with Walker Partners. Back in December, as the court remembers, we approved this proposal from Walker Partners. The total fee was $24,000. This is an invoice totaling $4,850 for the final documents and the franchise utility coordination. We just need a motion to approve the invoice.
Okay, there's details in your package. Any other questions or comments? Not, what's the pleasure, court?
Move to approve.
Second.
Have a motion second. Any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed? Pass.
Under item P, the McLennan County Radio Tower Project. P1 is authorization of tree removal proposal from Fitzgerald's for the Woodway Tower site. Ken?
Meeting out at the Woodway site, there's 12 cedar elm trees on the site where we want to build the new tower in Woodway. And when we met out there, it was discussed, and it was more or less talked about possibly one of the precincts taking down those trees so the tower can be built. But I talked to Ben about this. It's in a very confined space. There's a tower on the right, there's fences on the back, there's water line, there's other fences on the other side, then there's a power line that crosses in front of it.
Right.
So just in the conversation, we decided that we'd try to hire a company to take down these trees and grind the stumps. And so we got a quote from Fitzgerald's. It's someone that we've used here before, and they gave us a quote of $6,740 to remove those trees. And coming to the court for your approval today, they issued the PO, or my understanding is they issued the PO to build the tower yesterday. And the contract's gone to Western Towers. And so it's one of those things that's relative importance and needs to be done fairly quickly. So at the court approval, I'll probably issue a PO to remove these trees today.
I know one of the big costs, of course, is grinding those stumps down. Is there some application they put on them so they don't re-sprout?
Actually, I didn't know this. They didn't bring it up when we were talking about it. They were talking about stripping the roots. And That's not something they asked me to do, but the Hot Cog said that they would take care of that. So we just need to take down the trees and we'll grind them and then they're gonna pay to have
When you
the.
say Hot Cog, that's because they got the grant to. build it.
Yes, they're the ones that actually issued the PO to build the tower.
Right, good.
And Ken called and TJ did, and there's too many opportunities in this for my guys, and they're not good opportunities. So we passed on that, and it's $561 a tree, which is a,
Bargain.
yes.
Yes.
I've had one taken down. I wish I'd have got that price.
Okay, any other questions? What's the pleasure of the court?
Motion to approve.
Second.
Have motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Oppose? Pass.
P2 is authorization of microwave expansion proposal and related HGAC communication system and services agreement with Motorola Solutions for expansion of supporting microwave network for existing simulcast system. Ken?
Just a little background, I wanted to say, early on, we had a addition to our Motorola agreement to do the microwave systems. At this point in time, we had only received the financial information on doing the Road and Bridge Precinct 1 tower and Road Bridge Precinct 2 tower. This additional amount of money is for the microwave systems for Road and Bridge 3, 4, and I believe it includes the new Heart of Texas tower. And this is providing the links between the towers and the Waco PD downtown, creating a loop where we have redundancy in our system. And so the total amount for this is $1,451,387. It does include some support information down below, but I guess for right now, we just need the approval for the $1,451,387,000. And the tower at Precinct 4 is up, and so this is, like the next phase in trying to get everything connected.
Any questions? Anyone have?
So this is not a part of our original contract with Motorola, or is
No,
this
sir. In the original agreement with Motorola, the microwave system was not included.
The link?
We
Okay.
had committed to do that, and then when we had a person leave, we put this back under the umbrella of Motorola, but it wasn't included in the original contract, Motorola contract.
And where does the money come from to pay this?
Bond.
Out of
It's
what?
it's
Out of the
our
bond?
2019 bond, is that right? Is that what we,
Or 20, maybe 19, you might be right.
2019 bond? Seems like we've been working on this for a long time.
Yeah, exactly. I just didn't see where.
Some, and then we received some grant.
Yeah, there's some grant funding.
Yeah.
That's where Hot Cog came in.
And Ken, I'm assuming life cycle services is another way of saying warranties.
Yeah.
Okay.
Okay. Any other questions? What's the pleasure of the court?
Motion to approve the proposal and related agreement.
Second.
Have a motion and a second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
All right, moving down to the supplemental agenda under item B, Human Resources. B1 is Justice of the Peace Precinct 4. I'd like to call it on, and I believe Judge Richardson is on via Zoom as well.
Hello, everyone.
Good morning.
So I have a request here from Justice of the Peace Precinct 4 on behalf of Judge Richardson. He is requesting to have the dollar placeholder for a full-time court clerk to be funded. He is requesting an additional staff member. He currently has 2 full-time clerks, and he's needing a third. The intent was to request this for fiscal year 2023. He's decided to move forward with it sooner because there is a more immediate need. He has his 2 clerks soon to be out on protected medical leave here in the next month or so. So that's prompting him to move forward with the request sooner than he had planned. We have pulled information from the Office of Court Administration, and there is data that would support the need for a 3rd clerk in his office, both related to the amount of regular cases that are being filed and disposed of, and also related to jail magistrate duties that his office is helping him support.
Which are every other weekend, correct?
Correct. And so I spoke with the chief clerk out there, and every time there's a jail magistration that weekend, there's at least 4 hours of uninterrupted work that needs to occur following those duties. And I'm not sure if you have it in front of you, I was trying to compile the information yesterday into a usable format, and so you could see from fiscal year 2018 to we went all the way back to 2018 because I know this past year information could be skewed because of the pandemic, but so we went back to fiscal year 2018, and from then on, the average amount of magistrate duties being taken on is about 42% compared to the other precincts, the other 5 precincts that can perform those duties. So the request is to fund the full-time position, and we recommended a budget of $37,385, which would be in line with other justice of the peace court clerks across all precincts. And the request is for that position to be effective today so that we can assist them in posting as soon as possible. We are not certain about the internal interest there may be in the position, so we do think there is going to be some time needed for the posting to attract applicants.
Is he the only one doing magistrate services right now on the weekend?
Precinct 5
Okay.
is also supporting those duties. They're actually the next, in my data, they're the next heaviest volume of jail magistrate duties at 22% across that same time frame from 2018 on.
And so they're basically mirror offices of one another with regards to productivity, and other than precinct 5 or precinct 4 only has, or precinct, has the 2 clerks instead of 3.
Exactly. They've been carrying about the same amount of volume these past 5 years, but precinct 5 has had 3 full-time clerks supporting their office.
Okay. 3 full-time? He has 3 full-time? JP 5?
Yes, sir. Yes, ma'am.
Okay.
I'd make a motion to approve the request.
Second?
There's a motion and a second. Any other discussion?
Question.
Yes.
Current budget, obviously, we had a placeholder. Will this at some point, we'll have to come back and have a budget amendment, correct?
I believe so. Yes, sir. I do also need to have a discussion with Judge Richardson related to furniture and equipment as well, to see if that's been planned for.
Give me a clarification on that placeholder. Was that placeholder connected with the discussion that because of that $20,000 threshold increasing for JPs, they may need additional staff?
Yes, ma'am. That is related to that, and so that dollar placeholder exists amongst all the precincts.
I know that allows us to transfer the money in, but right now what we're saying is that his workload is why he needs this. We're not constraining him that this new person has to do both, should that come into play, are we?
That's correct, and that may be a topic we need to revisit during budget and perhaps allowing the placeholder again. Because it is related to current volume and not necessarily that, that reason.
And Commissioner, I don't know, I haven't heard, have you heard if that volume increased as they suspected it would? I don't think it's.
I have not, and if it did, we would.
Well, they're just getting started with
I
this.
start to say, we don't have much data yet.
Senate Bill 6 is
Yeah,
just
we're just getting started with it.
April 1. So,
Okay.
Trying to get their arms around it, but jail provides a lot of support in that area, and that's what we're trying to learn.
But that's on, the Bell referendum. That's not on the lifting, raising the levels of the, civil statute,
Yeah.
right?
Yeah, oh, yeah,
Two
yeah,
different
yeah,
things,
gotcha,
right? Yeah.
gotcha, yeah,
Yeah.
you're right. Okay,
And a discussion we'll have in the future, as you said.
all right. What's the pleasure of the court? Oh, we got a motion in a second. Any other discussion?
Yes.
No other discussion, all in favor say aye.
Aye.
Opposed, pass. Thank you.
Thank you.
Okay, Dustin.
All right, Judge, we have 2 action items left. One is the IT director, the discussion on the process for moving forward, the arsenic mitigation issue, and then IT has requested a security executive session as well. So I don't know what order y'all would like to do.
Let's hold the security deal as the last thing, so we don't have people having to exit and come back in. So,
Do we want to go to E3A2 as discussion and or action regarding the replacement of the information technology director, and to talk about the process, job description changes or updates and related matters? And I know Anna has worked on job description updates and I think shared those with the court. So do we just want to let the court review those for the next 2 weeks and
I
get
would
feedback back?
recommend that. I would recommend that.
So Judge, we could just defer this at this time.
All right, I'll make a motion, we defer.
Second.
Have a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed, pass. Thank you.
All right, Judge, do y'all want a break or just head to ARPA?
Well, do you need a break?
You
Okay.
said no.
Well, I'm pretty tough.
Tougher night.
Pretty tough, but I'm not unreasonable.
All right, let's take a 5-minute break.
Uniform.
go back into regular session. Okay, Dustin?
Yes, sir. So Judge, we can go to item K1C. This is a discussion and/or action on use of ARPA funds for arsenic mitigation projects and developing a plan for the distribution of those funds to water service providers. I'd like to call on Tom Ray.
Good morning, Commissioners. Pleasure to be here. I'm Tom Ray. Go through these slides very quickly. They're a follow-up to our last meeting, our last discussion of ARPA allocation of funds. Next slide shows the method that we used. I am not going to go back through this, but if there's any questions, I can answer those. Next slide. And this is the result of what we get. And one thing I want to point out, this starts with, if you look in the upper right-hand corner of that table, $10 million allocated towards infrastructure projects. That is an estimate only. It can change. If it changes, all the percentages remain in place and it redistributes. The other important point from this table that it illustrates is that we have talked about 4.4 million, which is 44% of that $10 million being dedicated to arsenic projects. Next slide. And there was a question last time about what's the confidence in the cost estimates that we were given. And I'm pleased next slide shows those projects updated. The next to the last column is my estimate or my opinion, I guess, of the confidence that you can have in planning level cost estimates that were provided. Most were done by engineers. Again, they're preliminary considerations of cost. And there's a whole discussion of how engineers go through cost estimates, particularly these days, very difficult. But my observation was that these cost estimates that we were provided are sound estimates and can certainly move forward with those at the planning level that we're at. Next slide.
Tom, excuse me just a
Yes,
minute. Let me make sure it's, I still don't see EOL water supply on here, and I don't want to get things approved if they're not, everybody's represented, and it's a big part. It's actually larger than Axtell. It's called EOL, or Elk Oak Lake Water Supply.
Well, I did that, and I guess this is.
You didn't hit save.
This is the prior one. We can recognize that EOL will be included.
Okay.
Okay?
And that's arsenic mitigation?
Yes, sir.
also?
They're part of the arsenic group. Yes,
Okay.
sir. Huh.
Then I have a quick question. Where would the Old Springfield Road water requests? Where would we find that one? Where they were asking for the water connection?
I'm sorry, I
Old
can't.
Springfield Road?
Old Springfield Road.
Connected to-
Let me see.
Is this just arsenic though right now?
Right now, it's just
Yeah, it's
arsenic.
just
I need
arsenic.
to check on that,
I
Commissioner.
don't think theirs had an arsenic related
Yeah,
issue.
theirs was a connection.
No, theirs was just connection.
Yeah.
Okay, well, I saw the generators and
Yeah.
then other recent projects added. These,
Complete.
all of this is just arsenic, even on the second page and
No,
everything?
the ones on the second page are a variety of different projects, generators, and then below if you look on the far left-hand side of the graph, it identifies the three groups of arsenic impacted areas and then the generators. And generators are included in several of the projects, along with other infrastructure requests.
Okay, so we were gonna put, and that's where, Chapel Hill, I believe is the church, but the actual road is Old Springfield Road.
I don't recall getting a request for that, so.
I know we talked about it
Yeah,
in here, did we not?
We
Didn't it show up?
discussed it in here, but I don't know if he got a request
Yeah,
from
he-
them.
Well.
Justin, do
yeah,
you have,
Yeah, and Tom, it's probably one, I'll resend it to you, but it's one that we had discussed before in court and we had forwarded it over, but I'll look for it and send it to you right now.
Okay, thanks. We'll get it in there. Again, it doesn't relate, it's not included in the arsenic group, so we're good to go. Also, in terms of allocation of the arsenic funding for those three groups, we have discussed doing that based on the number of meters in those areas, so we will handle it that way. And that, I think, makes for a fair distribution of the cost or the funding for arsenic related. All right, other questions on the table? Next slide. Next slide. This is my recommendation regarding the arsenic allocation and funding. To allocate 44% of the total available funding for McLennan County's infrastructure projects. Now, we need to caveat a bit and say that needs some flexibility because that $10 million can obviously go up or down a little bit as the final distribution of these funds is made. So we make it on a percentage basis, 44% of what's available for infrastructure. We've reviewed that several times, a couple of different meetings with the court. Therefore, as the engineer looking at this thing, I would propose to the court that we have had sufficient background and information to adopt that percentage, 44%, and recognizing that the distribution of the ARPA funding is to be based on the number of meters involved in each project area.
One question, Tom, we've talked about total amount, and I certainly support this idea of moving forward, getting off center on the arsenic needed improvements and what's out there. Do we need to put the 10 million in there? In other words, if a proposal comes forward or a recommendation comes forward or motion, that it be $10 million and that of that 10 million, 44% be set aside for arsenic, and it be distributed based on count of meters in those areas, those impacted areas? Does the 10 million need to be in?
I don't
there
think
now?
so, but that is a good point about mentioning that the basis of our decision, or of our allocation would be based on a pro rata to the companies by number of meters.
But at this time, because we've used 5 million, we used 10 million, we looked at 20 million, so we don't need to put a total in at this point in time of our ARPA funding. Is that what we're saying? Or is that the recommendation, or?
It's my understanding that we don't have that number, the amount, the total amount that will be finally available for the ARPA infrastructure funding nailed down yet.
Okay.
There's some things going on, you could get some money back.
It's fluid, okay.
It's fluid, yes, sir. So I tried to define it and say 44% of the total available funding.
Available would be the key there. The
Okay.
word would be available.
Yes,
Yeah.
yes.
Okay.
Tom, can I ask you a question? Can you
Yes.
go back to that list, where you were at before?
Go
Go
back.
back to the table.
Yeah, the table, I'm sorry. And I'm
Back
looking.
one more, I think.
Up one more, yeah. City of Riesel, you have 453, but they also serve MS. So their actual number of meters, they have 490 themselves, and they have 248 for MS, so they have 738 meters.
Okay. Well, I need to add that. I asked their engineer what their meters were, and she may have understood I needed the total meters for the water system that would include their customers, but Mike will certainly put that in there.
Yeah, it's
And,
7:38.
and in fact, we need to, be pretty, since that is a basis of allocation, we've got to have a pretty firm number in there, our best estimate of that.
Yes,
Well,
absolutely.
And,
my
and some
suggestion-
documentation of that.
My suggestion is that we do like we did for the volunteer fire departments, and we send them a statement to fill out that just says, I swear and affirm that there's the city of Riesel water system serves 738 meters, and have it signed and notarized.
And
And
they,
they
and I
send-
think
they
that's
all
what
send it in.
we'll ask all of them to do, and I think, we need to qualify that this, allocation for arsenic is gonna be based on certified numbers of meters that are within the county,
There you go, in McLennan County,
in McLennan County.
in McLennan County.
And that there has to be, they have to, describe their solution, so they're gonna have to work with their engineer to do that. And we will make sure that the, solution is implemented and resolve the issue for us to give them the money. I mean, we can't give them the money and then they don't resolve the issue, so.
That's right.
So that's where, Mike, you and Dustin and Tom come with a good subrecipient agreement that the court can look at.
Yeah, the other thing is, we talked about 10,000 and whether that 10 million, whether that goes up. At some point, if 20,000 went there, we wouldn't want to still do 44% to arsenic, right? We would want to maybe put that in the limit. I'm just not sure if it went up again, you could have some numbers in there that exceed what they need.
So Mike, are you recommending that we put an amount in at this time, like the 10 million we've talked about, and maybe subject to if other available funding, and there are more needs, then we'll look at that also?
Right, the situation is, if you want to get out a notice of what they're actually going to be granted and get a contract, that's, it leaves it open. And we'll look at it and see if there's not enough there after splitting up the 4.4 to do the deal. Maybe we do make the 44% out of any additional. But really, right now, if we hit what they need,
Volume up right there.
if we hit their numbers, that they submitted, that's what they need, why would we do the 44% out of all other monies that are added to the water? You see what I'm saying?
No.
No?
I follow that when you say 44%, you need to have a firm number on the other end of that to know that it's 44% of what? 44% of zero is zero, 44% of 10 million is 4.4. I understand that point, but what are you saying past that?
I think, and Mike, I'll try. I think I understand what you're saying. So like for Riesel, as an example, the cost reported by them is $1 million. So Mike's saying you cap theirs at that million. And if the 10 million bucket for arsenic goes up to 15 million, or the 10 million bucket for water goes up to 15, Riesel would still be capped at whatever their cost reported was.
Yeah.
Okay, but are they capped because,
That's all they asked for.
Because that's what they asked for,
because
yes.
they asked for that, okay. But if we're doing it by, if when you take all the arsenic companies and you add the total meters up and you divide it into $10 million or 4.4 million, and it comes up to a cost per meter that then you apply back to that particular water company, and if they have 100 meters, then they get 100 times what that number is per meter. If they have 1,000 meters, they get 1,000 times that number, period. Isn't that the formula, Tom?
I think I'm following what you're saying, and I think that would be the formula.
That would be a basic
That would be-
formula to start with.
Yeah. Now, you have the option, who knows whether we really don't know if that 10 million is going to be the final number. I certainly understand if it goes to 20 million, the court may want to say, well, that 44% is not the right percentage. So, you could consider an alternative to that to say 44% up to 15 million or something.
Well, and it might be, and like you brought up, Commissioner Smith.
Hey, Mike, talk up a little bit more in your mic. It's hard to hear you.
Okay, it, like you talked about, Commissioner Smith, it might be that based on the meters, some of these smaller ones or some of them may not get the full amount of funding they need. So, in that case, then you would want it to address the 44% to any additions to it. But right now, I was just thinking, well, if we cover every request they have, like the total request for Prairie Hill Water Supply Corporation is $270,000. If we would cover that request, would we be throwing additional money at them beyond what they asked for? And the same with Riesel and Leroy and.
We're not going to throw any additional money if the formula's there. If you take 4.4 million, divide it by the total number of meters, and then multiply that number back time the meters within that district, you're not throwing any extra money. You're throwing an exact amount of money at them, and then it would seem to me it would be up to them to prove up that they need additional money.
Okay.
I think
I got it.
Give them the higher of the two. And my question connected to that is, on the smaller requests, I just want to make sure the counting of the meters is fair, especially for these communities that are not necessarily as dense as other communities. Where their requests are smaller, and we could perhaps fund that whole project based on that last spreadsheet that you gave us, are we crippling some of them by going to this meter count as the sole funding determinant?
I kind of, I see where you're coming from. If there's a company that has, that their fix is $3 million, and another company over here, theirs is $3 million. But this one has fewer meters, and so their allocation doesn't cover relative to their cost to fix is much lower than a dense populated one that is closer to maximum ability to fix the problem.
Exactly, and,
Yes, sir. Yes, sir.
but the one with the more meters, you have more people that are affected, so there could be some balance there that justifies, but
Yeah, we may be trying to
Right.
refine it too.
I don't have off the top of my head exactly how you would
But to our.
allocate.
And you know what, I think to our advantage, it looks like those communities aren't asking for the up in the millions. And so what I'm saying is before we throw everybody into a formula fix on those that have smaller ones like Prairie Hill at 270 or Pure Water at 311,000. I'm trying to stick to the arsenic. If their amounts are, well, they're not in the millions, and perhaps we could look at funding the total project because of what they're requesting, do we put them at a disadvantage when we just throw everybody? I could see the need for the formula fix because some of these, what you want to do is you want to be able to fund as many projects equitably as you can. But on the smaller amounts, are we putting them at a unnecessary disadvantage?
Well, are you
When we
saying
just
that
let
in
me-
some of those instances, we should fund all of it? Is that where you're kind
You
of
didn't have
going?
to come so straight, bottom line.
Because I don't think we should fund 100% of any of these, to be quite honest, because I think everybody has to have a little bit of
So
skin in the game.
small. Like the amounts are small, and these are really poorer communities that haven't had the, resources
But-
allocated their way.
But then
I'm
it
just
gets tough,
wondering.
because then okay, well, for this one, we're gonna do it, but for you guys, we're not, and I would get a little concerned. Surely they can come up with a,
You could kick out, and don't take this, I'm not saying this, but
Gotcha.
you could kick out the big ones and literally fund all the small ones. There's a $5.5 million request, and then there's a almost $7 million request. And so, to me, that kind of skews what that kind of hurts these smaller ones.
but you got so few meters, you're not really helping the mass of the communities now. You're just helping a small portion.
Well, it goes back to the thing we talked about, whether they have funding from any other source and have actually do have a project. You look at this one that's 5.5, it's obvious that you would be paying for the full thing because it's a Waco water connection. There's no indication that they have a water development grant or loan, so you would be paying for this whole thing. If you did it by the meters, but still yet, even with the meters, it's not going to get anywhere close to covering that. So are you giving somebody money for something that's not going to be able to be done?
You don't know that with any of them, Mike. There's no guarantee that any of them, with the funding they've received, will be able to do what they want to do unless they add some support to it, unless we fund the whole project for them. And I lean toward Commissioner Perry. I'm not necessarily in favor of funding somebody 100% and then telling somebody else, we're only going to fund you 50%. And it's going to come out of those taxpayers' pockets as opposed to other taxpayers getting the slide.
Couple of things
Also-
here that may be important is, number one, the Prairie Hill Axtell that's not the total cost. Those are facilities they need to finish out, if you will, the arsenic solution. So they're paying more than that, but they've got that lined up through the Water Development Board. And the second thing that I was kind of basing this on is this funding, this arsenic, and again, we're talking about just the arsenic, will, the goal is, as I understood it, to reduce the cost at the meter.
Right.
Is that correct?
Yes.
So I think even though it may not do all the project and that kind of thing, their positive effect, bottom line, would be a reduction. And, have to get Mike and Dustin involved to make sure that the recipients understand that this needs to reflect a reduction in the meter cost to the individual customer in those systems. Okay? Because they could certainly spend that money somewhere else or, whatever, and the individual customer not see the benefit on their water bill.
Yeah, I think, we gotta get on with this thing, and I don't see, there's always gonna be so many different variables that we're not gonna be able to get there. Looks like to me that what we're providing is a subsidy to the meter, or to the homeowner or the user. And, it doesn't fix the whole problem, but it softens the blow.
Softens the blow.
So, several of these already have loans lined up, and it's gonna impact at the meter. So what we would need to do is whatever their allocation is per meter, that they go to their lender and say, we need to reduce the amount of this loan so the P&I, the amortization is lower, so, because the debt service is being serviced by the meter, so we can soften that.
Makes sense. One suggestion I would have is that you could stay with this general concept, this 44%. We would recognize the comments that Mike's made, maybe in the future, need to adjust 44% up to, 15 million, or some number that makes sense so that you're not overfunding, if you will. But, really tighten it up, that allocation. That's the principle. But we're going to tighten it up when we give you this money, and you're going to sign a document, an affidavit, or whatever Mike and Dustin come up with, that stipulates that, you're going to perform, you're going to get the project done within the ARPA requirements. It's got to be a number of things in there. And I think the court would have the flexibility to have input on that follow-up document and, adjust things, tweak things a bit more with the objective of making it, recognizing any issues that might cause a problem in that overall general approach, and get those tightened up in the agreements.
I like that. What about this, on that note? Because there are so many variables to some of these projects that we're just not privy to because we haven't been in meetings with them on a one-on-one basis. Maybe on the smaller projects that funding them at the 100% level is not a bad thing to do, and it's possible and feasible. And so, on the larger projects, I think that's where we have to have more one-on-one with them. Because if I had my way, we would have did the water projects first, and then we would have started looking at nonprofits and all of that. I just thought this was a opportune time to fix a major infrastructure in the county. And we know some of them have loans and things of that nature, but that usually gets passed on to the homeowner. And this is just not a time to pass on costs to property owners. So on the larger, because we're looking at this as if we've capped ourselves at 10%. I think we've had discussions where we said we might put more money in the water projects over the 10%. So after you've funded the smaller projects and let them get on with what they need to do, we do a one-on-one with the larger projects. And we even see, based on the resources they have, exactly how the county can come in and maximize and make sure that those projects happen. Because it doesn't make any sense to fund projects and they don't happen. The whole point of it is that these projects are going to happen and be a benefit. I think we're probably gonna have to put more money in the water projects, and I think we need to have, I don't wanna put more on Zane or Luke or you, but I think we're gonna have those conversations with these larger groups, a one-on-one, and see what resources they have on the table, and exactly how the county comes in and at what level, to make sure that that project happens.
And I'm leery for that. I don't want to get too far into the weeds. I don't want to get in their boardroom and start making decisions that they need to make for themselves. And I'm still supportive. Do we need to consider more money? We very well may, but I'm still in favor of a per meter, regardless, per meter across the county. We need to count on them to do their job as well. And I just don't want to get into the boardroom, well, they had this mitigating factor here, and, you know, I think we
Well,
per meter, and if they get it done, great, and if they don't, we tried and we gave them the opportunity,
And
ability to.
yeah, and I'm gonna put forth a motion in a minute, and it's gonna sound terrible, and I'm open to any corrections on it, but I agree, we need to move forward, but I think in the motion, it needs to include that additional money can be put into it if the need arises and people can prove up that they need more money. You know, they can come to us at that point. Here's the amount of money we have right now. If you make it work, it works. If not, then come see us, or else we'll take the money back. I don't know how, Judge, I'm ready to make some sort of motion.
Take a stab at it.
All right. I would recommend that we initially place $10 million into water projects, with the stipulation that 44% of those be used for arsenic mitigation, with the understanding that that 10 million can be adjusted as needed, on an as-need basis, on an individual basis. And that be based, that 4.4 million initially be based on a meter count per company, again, with the understanding that if that doesn't suffice, that they can come back to us with future needs and why, if it's possible. It's subject to approval through the county, to some sort of agreement with the county, and that the agreement has a project completion date to satisfy ARPA requirements. Now, that's as general as I can get it as far as moving off square one.
And I just add meters in the county.
Within McLennan County.
Some of them have meters
Right.
outside.
And Commissioner Smith is.
I'm a
Commissioner
second,
Smith
we can have discussion. So you're saying meters as the sole determining factor on funding?
Not if it doesn't meet their needs, then they could come back to us on an individual basis and explain to us why additional money's needed. And at that point, if we need to add more money to the projects, then we have the flexibility to add more money to the projects. But initially, meters.
Mike, did you have something?
Yeah, Commissioner Smith, as part of that, do you want to add Dustin and I sending out requests for the number of meters?
Absolutely. Certification of number of meters in McLennan County. Yeah. But folks, in my mind, we've got to start somewhere.
Well,
Right.
And I think that's a fair assessment. The only thing that I will push back on, I don't want to become a person that's running a water company. I think they need to, and I'm sure they're willing to do that. I'm sure they're willing to do whatever they need, or we need them to do. I just don't want to get too far into making decisions based off of lump sum of money per meter. If it's more, it's more, but yes.
My mindset is that this is a sufficient amount of money. I'd have to see some real mitigating circumstances to add more money to it, but I'm not saying we can't if we have money available.
And I guess, I second it for discussion. And I guess if I was sitting on the side of the county with the dense populations, I would be for meters too. So I still say, since I sit on the sprawling side of the county, and I also sit on the poorer side of the county. Less resources, less property owners, and less ability. It's gonna hurt this side a little bit more if they see increases on their meter. If they have to, and they still have the same need. See, it would be different if they didn't have the same need. They still need to mitigate arsenic. You know, mitigating arsenic in Lorena is the same as mitigating it in Riesel, but the head count is different. And so we're saying the head count is different, so this water company is gonna get more money. The head count is lower, this water company doesn't. So I really don't like that the sole basis of allocation is based on head count and not on project, the critical need of the project.
I just add one thing, or make a point there. We're not for sure, we're assuming that it might not be equal treatment. We're assuming it might not. So I would say that any member of the court can do an analysis to, if they show that it's not equitable or equal, then they can come back to the court always, and, you know, we can always rethink it, but but we would have to rescind what we approved today and replace it with something better. Yes, sir.
I would make one observation that we're just talking about the arsenic impacted areas. And the arsenic impacted areas are clustered in more or less the same general area.
Yeah.
Okay. I can also observe that, and I can look into this if the court chooses, the Water Development Board makes allowances for economically distressed areas. May be able to do some of that. There's ways to factor that in. You'll have to pay me more money to do it, but no, there is a way to look at that if the court so chooses, but I do believe that sort of thing could be added, not later, added as part of the agreement. That this agreement recognizes a disparity in economic income or whatever, and makes an adjustment and maybe follow the Water Development Board's approach.
If I'm not mistaken, every one of these water systems are in precinct 2. So I don't.
On the arsenic impacted,
Yes, ma'am.
Leroy.
one of them is in 3.
Yeah,
Leroy Tours, and then Axtell, Prairie Hill, and Riesel.
But we're only talking about arsenic at this point in time.
We're only talking about
And
arsenic, yes, sir.
if we max out our funding of the 10 million, we can always come back and adjust that number for these other water projects if needed. There are other water projects out here that are expensive also. And we're only talking about 4.4 million out of the 10. If that needs to be, like I said, if looking at these other projects and some of these other that just need to replace lines or storage or something like that, those are going to be dealt with separately.
Yeah, those have no relation to the 4.4 million. Or
These are the only ones that we're talking about right here, plus the other one that the judge mentioned that wasn't on here, Judge, which one?
EOL.
EOL?
It's one of the
Okay, so that's the fourth group, I guess. We've got Leroy Tours, Gerald is 1, Axtell Prairie Hill is 2, City of Riesel 3, and EOL would be 4. So we're talking about 4 groups right here that we're trying to mitigate their arsenic problem.
Okay.
Okay.
All right, we have a motion on the floor and a second. Any other discussion? Not call for a vote?
Commissioner Smith,
Aye.
Commissioner Miller,
Can you say you're not ready to vote in the week?
Pardon me?
Nothing. Aye.
Judge Bolton. Commissioner Jones.
Aye.
Commissioner Perry.
Aye.
All right,
So you
passed.
did put that
Thank you.
caveat in there. You put that caveat.
All right. Anything else for Tom, Dustin?
No, sir, that should be it.
Tom, I have one more thing.
Keep it short, please.
Okay, 738. That's the number.
Okay. What's the
On
number?
Riesel.
Total?
On Riesel.
In Riesel.
What are you, the Riesel city manager?
Almost.
Yeah.
Almost.
No conflict of interest here. We gotta
Yeah,
be
we
careful.
talked about
We
that.
want certified, so
Yeah, just like the,
we'll get the details. That's enough detail. All right, thank you, Tom.
yes, sir. Thank you.
All right, Dustin, we need to handle this one security item.
Yes, sir. So that should be all the action items on the agenda. And if we could go into executive session under 551.089.
Okay, all right, this
taking action on this.
We've taken care of it.
Recording in progress.
Okay. The court is out of executive session, back into regular session at 12:29 PM. Is there anything else that comes before the court? If not, we're adjourned at 12:29. Thank you.
Recording stopped.